Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. With me today are Director Mike Sprayberry, Brian Tipton, and Valerie McMillan are our American Sign Language interpreters, and working behind the scenes are Spanish interpreters Jackie and Jasmine Matevier. I'll start with a rundown of the numbers. As of this morning, there are 9,948 laboratory-confirmed cases in 98 counties. 551 people are currently hospitalized, and sadly, there have been 354 deaths. Yesterday, researchers from Duke University, Novasci, RTI International, and the University of North Carolina shared some good news for the state. Governor Cooper's strong action and all of your actions to stay at home and stay together to save lives have slowed the spread of the virus. As a result, fewer people have gotten sick at the same time, and our hospitals have been able to provide care for those who need medical attention. Together, we are flattening the curve. The researchers' model shows that a phased approach to ease restrictions will help us avoid any worst-case scenarios when it comes to the capacity of our healthcare systems. They do warn that complacency could change that, and that we need to be sure to keep up the actions that will slow the spread of the virus as we continue to loosen restrictions. You can find that full report on UNC Shep Center website. And now, we know we're fighting the largest public health battle that our state has ever faced. We need our public health teams, our doctors and clinicians, our first responders, frontline workers, and others leading the charge. And they're going to need the financial resources in order to appropriately respond to this crisis. So with the General Assembly back in session this week, they're working on a package to distribute federal dollars that have come to North Carolina to help us respond to this crisis. Now, yesterday, the Senate released their original package around the budget, which I do not believe provided the appropriate level of funding needed. We need to see continued work this week to include some of the critical funding that's not yet included. Funding for public health at the state and local level, funding for our rural and underserved communities and the doctors and hospitals who serve them, funding for food, shelter, and other safety items focused on activities that were included in our proposal. I've shared these priorities with Senate leadership, and I'm looking forward to continued work this week so that those are reflected in the final package. North Carolinians have pulled together to respond to this crisis from day one. I'm particularly proud of the rapid and extensive work our teams have done to make sure there is food on the table of our friends and neighbors during this challenging times. School nutrition and transportation staff have worked tirelessly to ensure children continue to receive the nutritious meals that they need while they're out of school. In the first month alone, 1,000 meal sites were stood up and served over 11.6 million breakfasts, lunches, and dinners across the state. North Carolina families who received food and nutrition benefits also got the maximum amount allowed for March and April. And soon, we're going to have a new program up and running that will help families of 800,000 children who are eligible for free and reduced lunch. Those families are going to receive an additional $250 per child, provided in 2 installments to purchase food. Meals on Wheels continues to serve our vulnerable seniors, and in the first half of April, approximately 211,000 meals were served to 52,000 seniors. On April 20th, our North Carolina National Guard began deploying personnel and vehicles to support each of the state's 7 food banks. Families who need food assistance can text Food NC to 877-877 to locate nearby free meal sites.
Grocery store workers and
Spanish by texting Comida to 877-877. Please go to the state's website, nc.gov/COVID-19, for more resources. Let's keep looking out for one another and staying home to save lives. With that, I'll turn it over to Director Mike Sprayberry for his report.
Thank you, Madam Secretary. Today is day 51 of our State Emergency Response Team's activation for COVID-19, and we're working to ensure the health, safety, and continued operation of our state's food processing plants. North Carolina is one of the top states in the United States for meat processing. We have 24 processing plants here, mostly for pork and poultry. Yesterday, the President invoked the Defense Production Act, declaring meat plants essential and requiring them to remain open to ensure the nation's food supply. We're currently monitoring North Carolina's several plants where employees have tested positive for COVID-19. Strike teams consisting of epidemiologists from the North Carolina Division of Public Health, the North Carolina National Guard, and local health departments have been performing mitigation measures to include implementing strong infection prevention strategies, performing testing for case identification, and executing thorough contact tracing. We want to extend a special thanks to the strike team members as well as to the employees who work so hard in those meat processing plants to ensure the state and nation have proteins like poultry and pork available to eat. Secretary Cohen told you about several ways we're supporting food needs across the state. Our National Guard soldiers and airmen are continuing their mission to support school feeding programs and food banks across the state. Those food banks need your support as well, so they can continue helping thousands of households that are relying on them every day for groceries. You can visit feedingthecarolinas.org to make a donation to a food bank near you. I've not mentioned North Carolina 211 in several days, but they remain available and have handled more than 33,000 calls since March the 18th. They can help with resources for rent and motel payment assistance, food, childcare, and many other needs. There are nearly 68,000 people getting twice daily informational texts, to include me, from NC 211. You can sign up for that service by texting COVID-NC to 898-211. That's COVID-NC to 898-211. Remember to check on your family, friends, and neighbors every day, and call your loved ones every day. Thank them for what they do, and I want to thank you for staying home to help stop the spread. That's how we're all going to get through this together, as one team, one mission, and one family. And now I'll turn it over back to Dr. Cohen for questions.
Great. Thank you, Director Sprayberry. We'll turn over to your questions now. Thanks so much.
Our first question is from Michael Highland with CBS 17.
Hi, Dr. Cohen. I wanted to get your reaction to this announcement earlier today in Gaston County, where they have decided to move forward today, start reopening some businesses there in spite of the governor's stay-at-home order. What impact do you think that's going to have on efforts to flatten the curve in North Carolina?
Michael, thanks for the question. You know, we're in a crisis, and I think confusion is really, really damaging during a crisis. I want folks to know throughout the state of North Carolina that the governor's executive order is still in place. It still stands. We're still asking folks to stay at home to slow the spread of the virus and save lives. So that's the state of the state. I will recognize, I know folks are frustrated, and I know that this has been hard in so many ways, and we're trying to move through this in the best way possible to protect health. We're trying to look at the data from across North Carolina so that we can step through different phases of loosening restrictions. We already know businesses are open right now and are protecting their employees, are protecting their consumers, and we're going to slowly expand that over the next coming weeks. We're going to keep looking at that data and make the modifications that we need as we go forward. So hang in there with us. And just so you know that the order is still in place for the full state of North Carolina, and I'm appreciative of everything everyone is doing to slow the spread of the virus. What I can say is it's working. You have truly flattened the curve. We're doing great as a state. Let us walk through this together. That's how we're going to be strongest. Thanks.
Next question is from Steve Wiseman with the News and Observer.
Hey, Dr. Cohen, this is Steve Wiseman from the News and Observer. I have a couple questions for you about the trends we're seeing, key metrics. I noticed that the hospitalizations kind of jumped up today with 500 for the first time. At the same time, your percentage of positive tests has dropped down into single digits, which looks like a good thing. Can you just discuss what you think of those metrics and how they're going to show us whether we can reopen again or start going into the stages next week?
Steve, thanks for the question, and you are following along with us as we look at these same trends. That's exactly why we wanted to lay it out for you very clearly. There's no one trend that everything is going to turn on. We do need to look at them in combination. So you're right, we did see overnight a bit of a increase in our number of hospitalizations. We want to see what that looks like over a period of time. Is that a trend upwards, or is that a one-day change in hospitalizations? We'll continue to watch that. But again, it's not going to be any one factor that's going to move us forward. It's going to be that combination. And I'm not saying we have to be perfect on everything. It really has to be the combination of factors. We want to do the right thing, not just to move through these phases, but make sure that as we do, that we don't have to revert back. We all know that this virus is going to be with us until there's a vaccine. So this is about how do we appropriately step through this in the appropriate phased way so that we can keep viral spread low and get back to our new normal. And you are right in saying that there are certain metrics that are going in the right direction. So percent of positive tests going down, that's a good thing. Hospitalizations up. We want to look at the total package. The governor and I tomorrow will go through those metrics in more detail, lay them out again, and talk through where we think we are tomorrow. So tune in for that announcement.
Next question is from Joe Bruno with WSOC-TV, Charlotte.
Hey, Dr. Cohen, this is Joe Bruno from Channel 9. How will the state respond if the governor's stay-at-home order isn't enforced and businesses reopen in a few hours in Gaston County?
Thanks, Gerald. So really, I think confusion during a crisis is really unfortunate, and I think folks should know that the stay-at-home order is in place. It still exists across our state. I'm appreciative to the many folks who are staying home and are obeying those orders. What I would say is that we know this is more than just the governor making a decision about opening or closing. We need to make sure consumers can feel safe as they go back to businesses. I was just on a call with business leaders this morning talking about just that. How do we think about shopping safer or safer shopping, and using that not just to say we're open, but to show that we're open in a way where folks can feel like they can go back, that virus spread is low, that they aren't putting their family or their communities at risk. And so that's what we've been working through with our business community, not only the answer about open or close, but how do you open in the most appropriate way to continue to protect workers and the community. And I'll say businesses have been doing a great job of this so far. Clearly, we have a number of businesses who are open right now, and they've been working hard to protect their own employees and to protect customers. And that's why we've seen the low trends in North Carolina that we have. So I want folks to keep up that good work. I'm appreciative of the businesses that have been working so hard to protect folks even as they stay open, and we're going to continue to focus on that work. I think we can find that right balance of protecting public health, but getting the economy back on track and getting folks back to work. So that's what we're going to do together as a state.
Our next question is from Andrea Blandford at ABC 11.
Secretary Cohen, it's Andrea Blanchard with ABC 11. A decision made on our K through 12 public school operations for this, and what changes as far as social distancing and other safety protocols are being discussed school districts could anticipate? Thanks.
Thanks, Andrea, for that question. So as many folks know, and as a parent myself of Wake County kids, we know that the school buildings are closed for the rest of this school year. They're going to continue distance learning. But as we look forward to the next year, there will be new things that schools will have to do in order to be able to open safely. We've been working closely with the Department of Public Instruction as well as superintendents to work through those details and what would it mean to operationalize things like more hand washing and cleaning surfaces. But we know we probably are going to look at things like not having large assemblies or reducing any folks in the large cafeteria at the same time. We also want to make sure that there are school nurses that are available in our schools and work to increase that. We want to have thermometers and other things available to our school nurses and other professionals so that we can do screening for kids as we go through. We want sick kids, just like we would want sick workers, to be staying home and not spreading germs, whether it's a COVID-19 germ or something else. So I think those are the things you're going to see us put into place. We're working through those details now with our folks in the education space, so our public health teams and the education experts together to figure out how to safely move forward with everyone as we look forward to the next school year. Thanks.
Our next question is from Elizabeth Ann Brown with the Asheville Citizen-Times.
Hello, Mandy. I am curious about the latitude that different county health departments have in their testing procedures out in western North Carolina. We have several counties where free testing of asymptomatic patients is offered, and 2 counties where there have been no cases and very limited testing. Does that speak to the different counties' budget restrictions, or is there an overarching state message to those county health departments that's guiding them?
Great question, because we've been, as you know, very focused on making sure that we have increased testing capacity as we go forward. That's been a combination of factors, so different places in the state have had challenges for different reasons. And so what we're trying to do is make sure that every community is going to have resources to be able to do testing. It might look different in different communities. So in one community, it may be at the public health department where that testing takes place. Others, it may be at the local hospital that sets up an outpatient or a community-based site. Another community, it may be something linked to our federally qualified health center. So I think it'll look different in different places based on the community's own strengths and resources. But our hope from the state is to make sure that we can provide folks with the necessary supplies that they need. So we're working to understand, do folks need additional testing supplies or PPE? So that's the logistical work that we're going through right now. But we do hope that every community will think about some consolidated testing sites. So we both conserve our protective equipment, but we get the testing out to all parts of our community. I know this work is happening already, and we're looking to fan that out across the state. Clearly, our local health departments are often the hub of that activity, so often it will be linked there, but depending, like I said, on a given community's resource, the partner that may be running with the work and doing it most may be one of the hospital partners, could be a federally qualified health center. It'll just depend on the community, and look for that work to continue to ramp up over the next week and month. Thank you.
Our next question is from Ken Smith with WRAL-TV.
Good afternoon, Dr. Cohen. Ken Smith with WRAL-TV. You opened with that study from Duke and other researchers saying that North Carolina is flattening the curve. What are the implications of that study, and what could happen as we move forward, since we're about a little over a week for the current stay-at-home order expiring? What are the implications here?
Sure. Thanks, Ken. And so the study that Ken's referring to is the one, as I mentioned in my opening remarks. It's on the Shep Center website if you want to see the full study. Well, when I look at it, it tells me that even as we go into easing of restrictions, we need to be very thoughtful about viral spread. It's showing us the virus is here, and that when we do get back to easing restrictions, we need to keep in place as many things as we can and take actions to reduce that spread of the virus. So as we ease restrictions, you're going to see things like asking our businesses to implement things where we can continue to social distance. So even when you're in a store, to maybe waiting online 6 feet apart, to make sure that we're wiping down high traffic areas like credit card machines and others. That we're going to be talking about face coverings and using face coverings as a way to slow the spread of the virus, particularly if someone might not even know that they are carrying the virus. So those are the kinds of things that I think that study tells us that we need to keep doing in order to continue the low level of viral spread that we've been having in North Carolina. What it shows us, if we went back to normal, I don't know, our normal is I'll say January, right? If we go back to what January was like, that they said there's still a great risk that we would very much have a surge in cases. We don't want to see that. And I don't think anyone is planning for that. I think our businesses and North Carolinians have been planning for this new normal, and that's what we want to get in place over the next week. We'll continue to look at our trends to make sure we're heading in the right direction. But then as we think about easing restrictions, we want to make sure that front of mind is to keep viral spread low, even as we go back to moving around more and getting back to some of our daily activities. Those are going to need to be done with some different ways of approaching it. But I think that study just reinforces where we already were, which is that phased approach to reopening and easing restrictions. Thank you.
Our next question is from Paige Peroso at WBTV in Charlotte.
Hey there, this is Paige Peroso from WBTV. Regarding Gaston County again, will the state take any action, or are you guys looking to take any action to stop Gaston County from allowing businesses to open?
So, hi Paige, thanks for that. You know, what I would say is the statewide order is still in effect. I think Gaston even acknowledges that in their own order, that the statewide order is in effect. And so that will be the thing that is governing folks going forward. So again, I just thank all of North Carolinians who have done such a good job of keeping our viral spread really low here in the state. We should be very proud that our state is doing as well as it has. So stick with this plan. Let us move through a phased reopening. We're only talking about next week, in which we will start to ease some of these restrictions. And then we want to do it in the smartest way possible, so that folks can feel like they have confidence when they go back to shop. They're doing it in a smart way. I think our partnership with the business community has been really strong at figuring out how to plan for that reopening in a phased way, and so that's what we'll continue to focus on. So we appreciate everyone in Gaston, but beyond, who are following the state's order and will continue to stay at home and then work with us through this easing of restrictions as we follow our trends, work on our testing, and work on our tracing. Thanks.
Our next question is from Kate Martin with Carolina Public Press.
Hi, Dr. Cohen. This is Kate Martin with Carolina Public Press. I want to know what happens in upcoming phases when we still don't have a vaccine, we don't have an effective treatment for COVID-19, and we start opening up the economy again, and an employee is asked to go back to work who has a compromised health position. Are they going to still qualify for unemployment if they decide to stay at home because of their health?
Kate, thanks for that question, and such an important one, because we know even as we start to ease these restrictions, we're going to continue to have folks who are at higher risk. We certainly have been thinking about that and discussing it as we think about reopening schools even in the fall. We will have teachers and students who will have underlying medical conditions that will need to be accommodated. And I think that we're having those conversations with business communities. about how to do that. How are they thinking about protecting their own employees? And then how do we give advice to our broader state and for people who have these kinds of conditions? You know, I was just looking at our data for North Carolina in terms of how many folks here in North Carolina have an underlying health condition, a chronic condition that may make them at higher risk for getting severe reaction to COVID-19. And it's close to half of North Carolinians that have either heart disease, high blood pressure, diabetes, obesity, or other chronic conditions. We're hoping to be able to release all of that information. But we've known for a while that North Carolina, our overall health is not as good as I want it to be. And as the Secretary of Health and Human Services, I have been working to try to improve the health of North Carolina, but we know that we have some challenges and we have a lot of chronic disease here. And so I think it's right for employers as well as the state and local governments to think about how are we going to continue to protect folks. I don't have all the answers today. I think this is where we need to work together on ways to look out for each other as we move through phases. It's exactly why we want to move through these phases slowly, because the more we can keep down the spread of the virus, the more it helps those who may be at high risk. So I think it's going to be top of mind as we go forward here in the future. Thank you.
Our final question today will be from Curl with the Daily Record in Dunn.
Hello, Dr. Cohen. This is Rick Curl with the Daily Record in Dunn. We've had, obviously, the release of information about outbreaks at congregate facilities. How much more information can we expect to get from NCDHHS on that? I mean, obviously, we're getting totals and things like that. How often, and I saw where it was going to be 2 days, but is there going to be more information released so we can maybe keep a better grasp on where it is and where it's going?
Yes, thanks, Rick. So yes, we have posted information about our skilled nursing facilities and some of our other congregate settings that may have an outbreak. Again, an outbreak is 2 or more cases at a location. And so we are updating that, I believe, twice per week. So it'll be not just the names of the facilities, but the number of cases that we are seeing there as well. And we are seeing that an outbreak is something where it's over a 28-day period. This is something defined by the CDC. So you'll start to see some of them come off as outbreaks end, which is a good thing as well. So you can continue to come back to our dashboard and see where our facilities are. I believe we'll update that twice a week. And again, that's because of the rapid change in the data. We looked around to other states for some of the best practices, and some of the best states are doing it twice per week. So we felt like that was reasonable to get everyone the most accurate information that we could. So I believe Mondays and Thursdays we'll be doing those updates. So thanks for that. And I just appreciate everyone's questions and focus on all that we're doing to keep North Carolinians safe. Appreciate everyone staying home to save lives, wash your hands, and enjoy the beautiful weather today. All right, thank you.